seal like this, what's the first thing that I want to check before I open this? I want to check the expiration date and the lot number. I'm going to save and hand off to Tony so he can chart the lot number. All right, I'm going to loosen this first.
There's also visual inspection of the packet to check to make sure that it's sterile, okay?
So as you open this up, I know now this was completely sealed across there. So I had to work to open that all the way across. So I know that the package was sealed here. Down here, there's nothing, there's no holes. So this tray's good, it's not expired. It expires in September of 2009. So then I'm gonna pull this out. I'm gonna hand this off to Tony. This manufacturer, they put a blue dot to show you the front of the tray. So I'm going to take this little hooky-doo that they provided for me, and I'm going to push this back like this. Oops, just put my add-ons. And of course, whenever I do this, I have my mask on, but it's hard for you guys to listen to me with the mask on. So, all right, so I pulled that one back away from me. Now I'm going to pull this one and give it that little snap. I'm going to pull that one, give it the little snap, and you can see this manufacturer also does a very nice thing. They fold it with these two tabs sticking up. So you're going to grab one of these tabs with this side facing you. You can see it's a shiny side. Untuck it from the tray, pull it down, and step away from it. Okay, so there's your sterile tray. Open it, ready to go. So now I can't touch anything on there. Now if I put gloves on, which sometimes I do, at that point I would set my tray up. So let's say I have my sterile gloves on. This is my prep stuff, and Tony's going to help me with this case. So I'm going to hand that off to Tony right now because he's going to do the prep. And then this stuff I'm going to uncover. Well, after I use the prep tray, this is the first thing I'm going to use to dry the back. So I'm going to put that there. This I'm going to use after I dry the back. So I'm going to put, this is my drape. So I'm going to put it this fold out side out. Here's the fenestration. That's going to go across the patient's back, so I want this side up. So you think about each step, what you're going to use. And then my 4x4s, I want to have them out. You can set these up your own way. Just remember, I want that. Then this is my catheter, and it would, if you just take the catheter out, it'll go all over the place. So this manufacturer has given me a little tear thing. So you notice the tip came out as soon as I tore it open, but I don't need that for a little while. So what I do is stick it under here so it doesn't fall anywhere and I know right where it is. I'm going to need this little guy. This is trash. Nobody uses them. So I'm going to take anything I'm not going to use, I get rid of. I'm not going to use this now, so I'm going to get rid of that. And then now here I have all my needles and syringes and everything that I'm going to use for the epidural. You also have this little thing in there that's glued in, and that's for you to stick your sharp needles in, okay? Manufacturers do different things, but every tray now comes with something like that. So what I'm going to do is I'm going to set up now. This is for my local anesthetic, so I'm going to put this on. I'm going to loosen the top, and then I'm going to lay it back down in here, okay? This is the needle that they're going to do the epidural with, so I'm going to take the top off, get rid of the trash. The reason you get rid of everything is because there's less chance of cross-contamination if you're done with all the junk, okay? Here's my little filter needle. I might want to put that on here. This is a draw-up straw, so that way when I draw up my medications, the way you get these out, this is tricky also. The way they manufacture this, and nobody seems to remember this, of your anesthesia people, they'll struggle and struggle to get these out. So the best thing is for you to do it. And let me show you the trick to that. These trays are made so you can push right here at the bottom. See how that brings that tip up? Now I can just pick it up like that. Whenever you're going to draw up medication, in order to see you got some medication up here, just spin it around like this a couple times. See, it's gone. So that just, centrifugal force just brings it down. Okay, the next thing you're gonna do is take one of these 4x4s so you don't cut yourself, and you're gonna break it, just like that. And don't do it over the tray. You see what just happened? It's flash, contaminated your tray. So always do them away. And then in the well of each of these, you'll see there's a little round spot. What that round spot is for these vials to stand up in. So you're going to stand up these medications for the anesthesia provider. That's the other way to do it. So those are the only two that the anesthesia provider that I'm working with uses. Now that I'm done with this, I throw it away. Okay? So now my tray's pretty much set up. The only other thing that I'm going to use is this. Now if I'm working with somebody like Dr. Tony there, he's fussy, so he wants to make sure this is done for him already. I'm going to pull away, sprinkle a little of this on there to moisten it, or you can draw it up. It's saline. And just, some people think that if you wet it, it's better, and you'd have your gloves on so you can do this. So now my syringe is ready as well. So I've tested everything, I know everything works. There's no chip in my glass syringe, because that can happen. It's moist, so it slides back and forth. And that's it. These other needles, I might use this when I drop my medication. So any of the needles, I just loosen the caps like that. Okay? Don't pull it off completely, because you might stick yourself trying to put it back. All right, so now my tray's all set. I'm going to take off my sterile gloves. And now I'm going to fully assist, so I'm going to have to gown.